Hello, I'm Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health here in the Las Vegas area of Nevada. It's actually in Henderson. And today I'm talking about polycystic ovarian syndrome and Hashimoto's thyroiditis, how this can affect fertility. And for those of you who suffer with polycystic ovarian syndrome, you know what a heart-wrenching condition it can be. So often you may not feel heard by your doctors about the weight gain that you're experiencing, the hair growth that you're experiencing, the abnormal menstrual cycle lengths. Frequently you're told, take oral contraceptive pills, maybe take metformin, maybe take other medications to help you with fertility. And with all that being said, many PCOS patients that I see are looking for alternative solutions to their problem. They're looking to get to the root of the problem. And PCOS ties in with Hashimoto's because the current research can be as high as 43% of PCOS patients have an immune response to their thyroid called Hashimoto's thyroiditis. The reason why this is so important is that it seems that Hashimoto's thyroiditis and polycystic ovarian syndrome increase the body's production of something called anti-Mullerian hormone. That's called AMH. AMH is involved with selecting good eggs out of your ovaries. And if you were to think of your ovaries as a pool with a bunch of basketballs in it, the anti-Mullerian hormone is pivotal in pulling out the best basketball, which is the best egg for that time, for you to conceive a child, or for you to then, menstruate if it's not that time of life. But it's important to recognize that anti-Mullerian hormone can be high with both polycystic ovarian syndrome and Hashimoto's thyroiditis, and it's thought that this is the reason why they both contribute to infertility in their own ways, but there are certainly other mechanisms as well that can be involved there. And so that's the data on these two conditions. I will elaborate a little farther in that polycystic ovarian syndrome has an insulin-resistant component that seems to drive it. There's current research now showing that insulin resistance largely stems from the gastrointestinal tract. There's also a lot of research regarding Hashimoto's thyroiditis having connections to abnormal gut bacteria, food reactions, as well as an Epstein-Barr virus within the thyroid gland itself. And there could be other viruses too, selenium deficiencies, vitamin deficiencies, reactions to plastics and other environmental compounds, other infections that can trigger the condition. But that's the condition at a glance for those of you looking to get to the root of the problem. And if you have questions on your condition, you can go ahead and look at the number below if you want an individualized approach to what you have going on. So I appreciate you watching. Thank you, and we'll see you later.